from the station that's on your side. This is Channel 7 News Daybreak.
Hey everybody, welcome back into Channel 7 News Daybreak. Joining us this morning is Baptist Health cardiologist Dr. Scott Davis, Dr. Scott Davis with Baptist Health. He's at the main clinic, not Sherwood, but great to see you, Dr. Davis. Great to have you in studio too, by the way.
Good to see you again.
All right, so today we're talking about a new study. I know it involves salt intake. What can you tell us about what the results of the study found?
Yeah, there's two things to look at. So this study that came out in the European Heart Journal was looking at the effervescent acetaminophen. It's a paracetamol. It's a pain reliever.
Oh,
right?
Thank you. Yeah. I was like, okay, where are we going with this?
Yes. It's a pain reliever, and it speaks to two things. One, this study looked at the effervescent component of the pain reliever and how much sodium it contains.
Okay.
And it then randomized and looked at 300,000 patients, either with hypertension or without hypertension, and folks that were taking this high sodium effervescent medication had a higher risk of heart attack and cardiovascular issues versus taking the regular tablet, right? And it speaks to a bigger issue. It's not only just, hey, pay attention if you're taking effervescent acetaminophen because it has a lot of sodium. It has 3 grams of sodium in one tablet.
That doesn't sound like a lot, though, on the surface. We think it sounds small.
Right, but the recommended daily is 2 grams of sodium. So you're all of a sudden getting, 50% more sodium in your in your diet or in your daily intake with one tablet. And so it comes back to what we preach to our patients all the time, and that is you want to be super conscious about your labels. And now it just takes it to another level of not just labels of what sodium levels are in the foods that you eat, because we're conscious. We try to do that, right? We try to look at the cans,
and it's listed.
Absolutely,
everywhere now.
But also now, pay attention to the medications as well, because look at all the additional medication, additional additives that may be in medications that you take, because this speaks to a much bigger issue of being label conscious in our world and in our life on the daily, and not only in the foods that you take in, but also in the medications that may be over the counter that for the one medicine I may want, I need the acetaminophen, the pain relief I get, but then the delivery that it involves, it may not be very helpful to my heart and to my heart health.
And you mentioned, just a 50% increase in the recommended daily value. You're taking that consistently. What kind of complications could arise from something like that?
So it showed a several-fold increase in heart disease risk in that group of folks. And what was interesting was it was independent of other risk factors, right? It was independent of having high blood pressure or being hypertensive. We associate sodium intake and hypertension, and yes, those do go together, and we want to curtail that. But it also impacted non-hypertensive folk to increase their cardiac risk as well. So again, a much bigger message is, listen, really need to pay attention to your sodium intake on a daily basis, because it does impact on the long term. And like I tell folks, we're just trying to redirect a battleship, right? I'm just trying to redirect your outcome and improve your risk, not tomorrow, but day after tomorrow, 5, 10, 15, 20 years down the line.
Always great to see you. Thank you again for explaining that, because we always looked on the dinner table what our sodium intake is, now in the medicine cabinet too, which is important. Thank you, Dr. Davis. Hey, Baptist Health information on your screen. If you'd like to contact them, do so with the phone number or go to baptist-health.com.